Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science, JAYOTI VIDYAPEETH Women's University. In the last lecture, we have discussed about the dermatitis introduction. In today's lecture, we are going to start with the endogenous eczema, and we will start with the atopic dermatitis. What is atopic dermatitis? Before atopic dermatitis, we have to understand what is atopy. Atopy is a predisposition towards developing certain allergic hypersensitivity reactions. So it is a predisposition towards developing certain types of allergic hypersensitivity reactions. Atopic dermatitis is the cutaneous expression of atopic state that is characterized by a family history of asthma, allergic rhinitis, or eczema. So what is atopy? It is the predisposition towards developing certain type of allergic hypersensitivity reactions. Atopic dermatitis is a cutaneous expression. It is cutaneous skin expression of the atopic state, and it is characterized by families of asthma, allergic rhinitis, and eczema. This is again atopic dermatitis. What are the clinical features of atopic dermatitis? We have pruritus and scratching. There is great itching and scratching. The course is marked by the exacerbations and remissions. So the condition is getting worse and it is getting improved. The lesions typical of eczematous dermatitis are present. There will be personal or family history of atopy. Atopy means hypersensitivity that will be covered by allergic rhinitis, asthma, food allergies, and eczema. The family history will always be positive. The clinical course will be lasting for greater than 6 weeks, and the lichenification of the skin will be present. This is the lichenification of the skin. Now, what is the etiology of atopic dermatitis? The etiology of the atopic dermatitis is only partially defined, but there is a clear genetic predisposition. So we have a clear genetic predisposition in case of atopic dermatitis. The mutation in the gene encoding filaggrin, it is a structural protein in the stratum corneum. So filaggrin is a structural protein in the stratum corneum. When both the parents are affected by atopic dermatitis, greater than 80% of their children manifest the disease. So when both of the parents are affected, greater than 80% of the children manifest the disease. And when only one parent is affected, the prevalence drops to slightly over 50% cases. The characteristic defect in atopic dermatitis that contributes to the pathophysiology is an impaired epidermal barrier. So we have an impaired epidermal barrier in case of atopic dermatitis. What are the various exacerbating factors that are leading to the increase in the condition of severity of the condition of atopic dermatitis? The exacerbating factors includes infection with the Staphylococcus aureus. Next one is the seasonal variation. The complaints of atopic dermatitis are worse in winters and these are better in summers. The clothing like wool and fur, which are commonly worn during winters, aggravates the complaints. And again, emotional stress is an important aggravating factor that can lead to the severity of atopic dermatitis. It displays a variety of immunoregulatory abnormalities. There are a variety of immunoregulatory abnormalities in case of atopic dermatitis. There will be increased serum IgE levels. The serum level of IgE will be increased. The impaired or delayed type of hypersensitivity reactions are present. The clinical presentation often varies with age. So there is a varying of various clinical features with age. Half of the patients presents within the first year of life. So half of the patients of atopic dermatitis are coming to us in the first year of their life. And 80% of the cases develop atopic dermatitis by the 5th year of their age. about 80% of ultimately co-expressed allergic rhinitis or asthma. So in max 80% of the cases who are developing atopic dermatitis, there is co-expression of the allergic rhinitis and asthma that is present in the cases. We have an infantile pattern that is characterized by weeping inflammatory patches. We have weeping inflammatory patches. We have crusted plaques on the face, neck, and extensor surface. There will be weeping eczema, inflammatory patches. There will be crusted plaques on the face, neck, and extensor surface. We have the childhood and adolescence pattern that is typified by dermatitis of the flexural skin. We have childhood pattern and we have adulthood pattern, adolescence pattern. That is typified by the dermatitis of the flexural skin. There is antecubital fossa. It is present in antecubital fossa or it can present in the popliteal fossa. Both are the flexural skin surfaces. So we have weeping inflammatory patches, crusted plaques, and we have presence in the flexural skin. Now, what are the clinical features? The clinical features of atopic dermatitis. In this, we have the pruritus, that is the main feature of atopic dermatitis. There are series of events that are occurring in atopic dermatitis, which includes itch. Itch is followed by scratching. Then we have the rashes and again itch. Itch, scratch, rash, and itch. We have three types of pattern. In this, we have the infantile pattern, infantile phase, in which the lesions occurs on the cheeks, forehead, and the scalp. Cheeks, forehead, scalp, and later on the trunk and extremities. In the childhood phase, we have the papules, lichenified plaques, erosions, and crust that are mainly on the antecubital and popliteal fossa, in the neck, wrist, and ankles. In the childhood phase, we have papules, lichenified plaques, erosions, crust mainly on the antecubital and the popliteal fossa, in the neck, wrist, and ankles. Now comes the adult phase. In the adult phase, we have lichenification and excoriation in the flexural surface, the flexural distribution. There is lichenification and excoriation due to extreme itching. How will you diagnose a case of atopic dermatitis? Diagnosis is done on the basis of clinical findings. Most commonly, the infancy onset. There will be severe pruritus and typical distribution that we have just discussed in the previous slides. There will be morphology of the lesions that will guide you towards atopic dermatitis, and the personal or family history of atopy will be present in such cases. On the basis of these features, the diagnosis can easily be done. Now, what are the differential diagnoses? The differential diagnosis includes seborrheic dermatitis, we will be discussing in the next lecture, irritant and allergic contact dermatitis. There will be psoriasis, nummular eczema, and dermatophytosis. So these are the various differential diagnoses that are needed to be discussed before reaching to the conclusion of atopic dermatitis. What is the prognosis? Atopic dermatitis may resolve spontaneously, but approximately 40% of all the individuals affected as children will have dermatitis in the adult life. Adults have localized disease that is manifesting as lichen simplex chronicus or hand eczema. So, it may resolve spontaneously, but 40% of the individual affected as children will have dermatitis in the adult life. Adults have localized disease manifested as lichen simplex chronicus or the hand eczema. This we are going to discuss later in this chapter. Now, what is the treatment for atopic dermatitis? The first and foremost treatment include avoidance of the cutaneous irritants. We have to avoid the cutaneous irritants. Adequate moisturizing is must for the lesions. Topical anti-inflammatory agents are required. Topical application of glucocorticoids and antihistamines for the case of atopic. So the treatment consists of avoidance of the cutaneous irritants, adequate moisturizing, topical anti-inflammatory agents, topical glucocorticoids, and antihistamines. So this was all about atopic dermatitis. We are going to discuss about the rest of the endogenous factors, especially seborrheic dermatitis, in the next lecture. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I will try to resolve it. So this was all for today. Thank you very much. We will be meeting tomorrow in the next lecture with seborrheic dermatitis. Thank you.